welcome to another episode of the Vetpedia, the official podcast of Kachelan-Pharma Research Limited. And as usual, I have another veterinary leader here with me. His name is Dr. Sulaimon. Dr. Sulaimon is a veterinary diagnostician with over 10 years experience and proven track record of solving farmers' challenges both directly and indirectly. Is currently the operations manager at Kachelan-Pharma Research Limited and also the head of diagnostics at Lanchak Company Limited. Stay tuned.
Listeners, I'm Dr. Taiwo Sulaimon of Kachelan-Pharma Research Limited. I'm a veterinary doctor serving in capacity of operations manager.
Okay, thank you so much. So you're welcome to the show. So, doctor, can you, in simple terms, tell us what vaccination is and how important it is in preventing infectious disease in animals?
Okay, thank you very much. Before we say what vaccination is, I think it's best idea we define what vaccine is. Vaccine, we say, is a biological preparation or agent that provides immunity to a particular disease. That provides immunity to a particular disease at any point in time. So it typically contains an agent that it is infused into the body that resembles that disease causing microorganism itself in a weakened or killed form. So it helps to simulate the immune response when it is being injected into the body. Now, what is vaccination? Vaccination is the process itself, is the process by which this vaccine is being introduced into the system. So we say it's a safe, simple, and effective way of protecting an animal or human being against harmful diseases before the animal comes in contact with the disease itself. So when the animal comes in contact with the disease itself, the body is already well prepared that, okay, this agent, the causing agent is no longer linked to the animal. So the animal sees it as part of itself, and in that way, it doesn't in any way bring about disease. So we also say it's the administration of a vaccine to help the body to develop immunity from a disease. Thank you.
Okay. What are some common infectious diseases in animals that can be prevented or treated with vaccination?
Okay, there are a lot of them. Generally, vaccine has been the most effective method of preventing disease in both animals and humans. And in some animals, we have specific vaccines that we use to prevent some of these diseases, either infectious or malignant disease. For example, in dogs we have rabies, which we all know as mad dog disease. Then we have canine distemper, we have parvovirus, we have leptospirosis, and so on. Then in ruminants we have anthrax, we have PPR, peste de petit ruminante, we have the foot and mouth disease, we have bovine viral disease, then we have lumpy skin disease. Then in pigs we have African swine fever, then we have transmissible gastroenteritis disease. Then in poultry, which is our homework there, we have infectious bronchitis disease, we have infectious bursar disease, also known as gumboro, Newcastle disease, fowl pox disease, Maris disease, and so on and so forth.
Okay. Are there any roles of herd immunity in animal vaccination program? Or can we even know maybe we should know what herd immunity is first before we discuss the roles of herd immunity?
Okay, herd immunity, I would just say in simple terms, is population immunity. It has to do with the indirect protection from infectious disease that happens when a population is immune either through vaccination or through immunity, or immunity through previous contact. That means when it's specific or a larger chunk of a population is immune from a disease, either through vaccination or when a large population of a specific population comes in contact with an infectious disease. So we say they generate an immunity over that disease when come in contact with that same disease in the nearest future. So it occurs when a sufficient percentage of the population has become immune to an infection, whether through previous infection or vaccination, thereby reducing the likelihood of infection for individuals who lack that immunity.
Okay. My next question now would concern both veterinary doctor or veterinary practitioner and the farmer. How do one determine which animal should receive vaccination and which vaccines to use?
Okay. Generally, how do you determine which vaccine or which animal to? Well, there are a lot of factors. There are a lot of factors to consider here. You have to consider the disease you want to vaccinate against, and also the animals. You cannot just say, okay, let me give this vaccine to this animal. Because you say these vaccines themselves are generated from the pathogens that causes these diseases from the body of the animal. So you cannot pick pathogens of diseases that cause pathogens of diseases from dogs and say you want to use it for chicken, for example, because vaccines itself are species specific, and also you must have the disease in mind, then the animal in question, also the overall health of the animal, and also the match between the vaccine and the pathogen. Thank you.
When it comes to vaccination, are there any risk and benefit? I don't want to use of benefits because there will always be advantage, there will always be disadvantage. So, are there any risk and benefits when it comes to vaccination animals?
Okay. Like you said, the benefits I will say outweigh the risk involved. But few of the risks that we have, majorly there are adverse reactions that we can get from vaccines, and probably if you have vaccine break, vaccine failure, when vaccine is not properly stored and used, or when there is break in cold chain and you administer to your animals, yes, there's every likelihood the animals will come down with that disease, because what you're having is beyond the the pharmacokinetic dose that you should have in that store. And when it is too much for the body to bear, definitely the animals will come down of that disease. Now, if you now look at the benefits are numerous. They are enormous. Now, it prevents disease transmission. And in our own case now, it also prevents the transmission of disease from animals to humans and also from humans to animals, which we call zoonosis. Then, it's also a cost-effective method in prevention of diseases. Just look at it, for example, now. You said you have a flock of 20,000 birds, for example, now. Vaccine of like 50 to 60,000 naira, when used on time, can save you the lives of the animals in question. But if the vaccine is not used on time, you can lose larger chunk of those animals. And you know what's the economic implication that means to us. So it is cost effective in prevention of animals, and also it is generally safe, efficient, and associated with few side effects, because it's better for you to prevent than to treat. So the cost effectivity is superb. Then it also provides suitable and economic stability for the farmers too, because if you lose birds, you are losing money. So as the farmer is losing too, the community is losing, also the country is losing. Then another thing we must also put in mind as regards the risk is this: we are not to vaccinate sick animals. Animals in poor state, we must not vaccinate them, and animals that are stressed, we should not vaccinate them. So I think that's
okay. So thank you very much, sir. Okay, now when it comes to, in fact, not just vaccination, when it comes to animal health and all of that, so many people are still less enlightened. So what are some concerns, or what concerns could be addressed about farmers' hesitance to vaccinate their animals?
Well, in a simple term, an English adage says, penny wise, pound foolish. If we refuse to do our vaccination as at when due, then we know we are playing with fire and with our money and our health status too. Because if you leave your animals unkept, if you leave them uncared for, then definitely diseases can just troop into your farm or into your house to get rid of either your pets or your farm animals. So in order for us to prevent that, we must take the necessary precautionary measures. It's not that when the animals come down, that's when you now start running and that, okay, I'm losing this. Let us prevent before it escalates to now lead to what we can no longer take care of.
Okay, thank you very much, sir, for that point. Nowadays, there's this thing called disease surveillance. There's this thing called monitoring, reporting. These are like strategies to curb disease, especially zoonotic diseases. Okay, so what are some correlations between disease surveillance, monitoring, and reporting in new vaccination strategies?
Okay, disease surveillance generally just has to do with you getting your data. Okay. I mean, continuous systemic collection, analysis, and interpretation of data, so as to prevent the occurrence of disease in an area. That's what surveillance is all about. Now, monitoring. Okay, you said, monitoring we deal with both the performance and the compliance. Why the surveillance deals with security oriented. You want to secure your animals. You want to secure your lives too. Now, generally, disease surveillance is often used to measure the impact of vaccination programs on disease burden. You want to know the impact of that disease on the population of your animals. You understand? Both your pets or livestock. Then it also provides vital information to help countries to understand the disease burden and epidemiology so as to inform vaccine potency and strategies. Okay. You understand? So when we are looking at developing vaccine or using vaccines or even in treatment of animals too, your surveillance must be of top notch for you to know that, okay, at so time I must prevent this, at so time I must use this to prevent this. You understand? So the surveillance and monitoring helps in both in designing our disease vaccination program and also in disease prevention. Okay.
I don't know if you listen to our previous episodes, but in every episode there's always this question that leads back to public health. Like, we're always trying to let people know that hygienic animal health will equally lead to hygienic public health. So now, how do vaccination programs impact animal welfare and public health?
Well, like we said earlier on, vaccination has been an effective way of preventing disease, and by so doing, that has reduced the disease burden in both pets and farm animals, and also is a key tool in maintaining both animal health and animal welfare. Now, just look at it from this point now. If your animals are not vaccinated, peradventure the animal now come down with, let's say, rabies disease, for example. Now, the animal becomes uncomfortable. By so doing, you are already tampering the welfare of that animal. The health of that animal is already being under question. The health is being tampered with already. Now, how do we now prevent that? The first thing that we need to do is vaccination. You understand? So it helps to improve the stability of that animal and also helps with the welfare. It also helps in agri and economic stability. Either you lose your pets or you lose the farm animals, invariably you are losing money. And if you are losing money, directly or indirectly, it will affect your family, it affects society, and it affects the country at large. Then it also prevents zoonosis. That is transmission of disease from animals to humans and the other way around. Then it reduces fatality and mortality in animal and human population. Okay. You understand?
Okay. So my next question, I want to quickly borrow this doctrine from this equity. Let me just borrow this equity doctrine that says, "Ibi juice, ibi remedy," and for every wrong there's a remedy. So, for every problem, I feel like there's a technology advancement to counter it. So, what future developments or advancements do you see in animal vaccination technology?
Okay. Generally, vaccine technology has been evolving. It has not been static. Just like we had during COVID-19, for example, within few months or a year of the disease emergence, some countries came up with production of vaccines to at least to prevent the disease at large. And also, if you look at it very well, from the time the first vaccine was invented by Edward Jenner, that was in 1796. It's vaccine for smallpox. Several other vaccines have come into production. And if you look at it, that's like more than 2 or 3 centuries now. Okay. But if it's been stagnant, then we would not be having new production of new vaccines. But in Nigeria, for example, I think the one that I feel is more important is, okay, how do you start producing in Nigeria itself? Yes, we have some that are producing like the NVRI, but are we producing in large scale to at least cover the whole populace? No. Is it that when we need the vaccine, do we readily get those vaccines on time? Not all the times. You understand? So we need to up our game in production of vaccine here in Nigeria. And also, look at marriage vaccine, for example. We need to start looking at a way of in-ovo vaccination, where we vaccinate our birds during that hatching period. So we can be sure that all our birds will be vaccinated against marriage disease. Not that when we have some that are being handled by humans, we say, okay, there is human error, there is social error. No. So another thing is the use of plants to generate vaccines, and also RNA, DNA technology too has gone a long way. So it will be glad if you can have something of such in vaccine production too.
Okay, thank you very much, sir. So lastly, and also rounding up the show, what roles do veterinarians and pharmaceutical companies plan, like Kachelan, let me just say pharmaceutical companies like Kachelan, plan in encouraging adherence to wholesome vaccination practices?
Okay, well, as you know vividly, Kachelan do organize seminars, workshops, and some things like that. And part of what we discuss with our people there is majorly has to do with animal health. There is no way you discuss animal health or health of the populace as a whole and you not discuss vaccination. So we always talk to our people that you must prevent disease before there is an outbreak on your farm. And how can we do that? Vaccination is one of the most effective ways. You understand? Then administration of these vaccines generally are being carried out by veterinarians. So veterinarians are always being part and parcel of this. In fact, we are at the forefront of it. So, and we as a company, we also run a lab where we do sero monitoring and also vaccination schedule for our farmers. It's a must that if you get your birds or your animals, you run screening on them, on the samples that you submit to us. Then it is that sample that will now guide us in giving you your vaccination schedule. So we always advise our farmers to please adhere strictly to your vaccination program, and also do that having your own health in mind, so that okay, if my birds are well vaccinated or my pets are well vaccinated, I can also calm myself to be safe from these infectious diseases too.
Thank you so much. That was pretty much insightful. Thank you so much, Mr. Sulaimon, for sharing that broad spectrum of knowledge on animal vaccinations. I need every listener right now to know that vaccinating animals helps in stimulating an immune response without causing the disease itself. This creates early exposure to disease-causing organisms where the animal's immune system is able to recall the infectious agents in which the animal is vaccinated. Vaccination offers an effective, inexpensive way to prevent a deadly disease from harming the animals in their care. These medicines are foundational to any animal health program, with the benefits extending even to public health. Yes, when animals are, protected against a zoonotic disease, it prevents transfer to people. Thank you.